Okay, greetings, brothers and sisters, and welcome to our study today, Sabbath, the 12th of July, where we are looking at pregnancy and midwifery in the Bible and the spirit of prophecy by Brother Keagan Banda. So, as Brother Keagan is preparing the prayer thought, I will be able to share the study for today. Okay, let me just share the study so that we now see what the Lord wants us to look at as we continue this our wonderful lesson. Okay, there we go. Okay, so sorry for what was happening. We had some interruptions in we had challenges with our network. I'm sure now you are able to see the screen sharing. At this time, I hand over to Brother Keagan to take us through the study for the day. The correct one, our prayer thought is coming from Adventist Home, page 56. Page 340, paragraph 4. And I start. When the Pharisees afterward questioned him concerning the lawfulness of divorce, Jesus pointed his hearers back to the marriage institution as ordained at creation. Because of the hardness of your hearts, he said, Moses suffered you to put away your wives, but from the beginning it was not so. He referred them to the blessed days of Eden when God pronounced all things very good. Then marriage and the Sabbath had their origin. Twin institutions for the glory of God in the benefit of humanity. Then, as the Creator joined the hands of the holy pair in wedlock, saying, A man shall leave his father and his mother, and shall cleave unto his wife, and they shall be one. He enunciated the law of marriage for all the children of Adam to the close of time. That which the eternal Father himself had pronounced good was the law of the highest blessing and development for man. Okay, the next paragraph. Jesus came to our world to rectify mistakes and to restore the moral image of God in man. Wrong sentiments in regard to marriage had found a place in the minds of the teachers of Israel. They were making of none effect the sacred institution of marriage. Man was becoming so hard-hearted that he would, for the most trivial excuse, separate from his wife. Or if he chose, he would separate her from the children and send her away. This was considered a great disgrace and was often accompanied by the most acute suffering on the part of the discharged one.
Well, with this, so you've gotten the reference, huh? So the reference is clear. It says God is against divorce, and during the time of the Pharisees, because of the law of Moses, people were, even with the trivial excuses, they would separate from their wives. Okay, separate from their wives or children, and the one who is to suffer was who? The one who had children, huh? That's the court. Okay, so we have to pray so that when we're in marriage, this thing does not happen, because there are more to suffer. The children are prone to suffer as well, and we should not find lame or trivial excuses when we're in marriage, as we are looking at pregnancy and midwifery. Okay, so that's what that quote is saying. It's endorsing. Okay, so we kneel down and pray. Our Father, which art in heaven, we thank you for today, the Sabbath, the day in which you rested from the labor that you labored during the 6 days of creation. You told us that we should remember this day because the 6 days you labored and you created all things. And also this day is a reminder that one day us we shall have a rest in heaven for 1,000 years. And this day also is our reminder that we're supposed to do the work just like the way you did in 6 days, the work of saving man, the work of taking the responsibilities of building the camp and making sure that your work is done here on earth. Today you are about to teach us about pregnancy and midwifery. May you help us, O Lord, to learn this because this involves life. May you help us, O Lord, to be glued in marriage because marriage is your institution, just like the Sabbath is your institution. May you bless us all. In the name of Jesus, we do pray with thanksgiving in our hearts. Amen.
Amen.
Amen. Okay, so I don't know if those people that were not there, we learned last time saying that the takeaway points that we learned from this previous points that we learned last Sabbath were that pregnancy, the full term of pregnancy. Okay. So the last time we learned saying that the pregnancy is caused by sex intercourse, by a person ejaculating into the vagina. There has to be a ovulation period. Then the ovulation period, a woman should be ovulating, meaning she should drop an egg, the ova. So if you have sexual intercourse without the ovulation period, not in the time of ovulation, meaning happen. Pregnancy is caused by sexual intercourse during the time of ovulation, and the man has to have quality spermatozoa. Okay, that is the cause of pregnancy. Then the other term for pregnancy is gestation. The symptom is missed period. The symptoms that you are pregnant is missed periods, tender breast, nausea, and vomiting. Hunger, that is hunger, then frequent urination. The reason why you tend to be urinating frequently is because the pregnancy will sit on your bladder. The weight of the pregnancy will begin to sit on your bladder. So you feel the urge of voiding or peeing. Okay. We learned also that complications in pregnancy is that a person may have what you call high blood pressure of pregnancy, then gestational diabetes. The gestational diabetes, it means you happen to have elevated blood sugar during pregnancy. That is gestational diabetes. So meaning that if your sugar levels increase whilst you're pregnant, meaning you're prone to give your child diabetes. This is called gestational diabetes. Then iron deficiency. Okay, this is very common. Iron deficiency. Iron deficiency in pregnancy, because the first three months of pregnancy, that is the first trimester, women tend to have nausea during pregnancy. So they tend to eat less and drinking water less, and because of this, they tend to have anemia. And again, others, they don't plan to be pregnant. Because of not planning to be pregnant, what happens is that the pregnancy will find you in the deficient. If the cells that you carried or you had, if the cells were weak the time you are pregnant, to make the pregnancy, it will rob you of all those nutrients that you have. So if you are not ready, that is mentally, uh, physically, health-wise, or in short, if you do not have food and your spiritual standing is low, if you become pregnant, your body is going to go to concentrate in the womb, forming the child. Forming that child, then the small nutrients that you have in your body is going to be robbed to form the child. That's the reason those people that uh, they are deficient, or they have less nutrients, or they eat poorly, their hair tends to be pale, and sometimes the teeth, they fall off. We've seen pregnancy making people to lose teeth. Okay, because it's very basics. The teeth, that's the first place. It's the storage of calcium phosphate, and calcium phosphate also is a requirement for the unborn child. Those are nutrients that are found in the bones and in the body. So the body will begin to leach out all those nutrients that are stored in the bones, in the teeth, and in the hair, so that it develops the unborn child. So for you, if you're planning pregnancy, you have to be eating well. For instance, in India, they say kapha, like beating yourself. You have to put yourself on food that will boost your body. It boosts your body by also boosting the sperm and boosting your vitality. And also a woman should do likewise to boost herself. Okay, then after that, after she sees, or a man sees, that they have boosted their body health-wise and also spiritual-wise, then now they can be ready to have a child. Okay, that's the thing that most of people, they don't, I think they don't teach also this one. So you have to know that. So antenatal, they basically teach saying if you're pregnant, you have to take folic acid, ferrous, then check if you have venereal diseases, STIs or STDs, and taking malaria prevention, that is Fancida or Famada. Okay, those are the basic things that they give at the hospital. But this, you've learned saying you have to prepare. There's nothing like robbing. If you are deficient, your pregnancy has found you that you are very deficient, you will be more deficient. Okay, the child is going to rob the entire nutrients that you have, then you'll be more deficient. Okay, because the way the ratio is that the child should get the entire nutrients, then you, it doesn't care whether you will be very low in nutrients, but the child should have the required nutrients for development in the womb. That's what happens. Okay, then the duration of pregnancy is 40 weeks. That is, of course, today they say 38 weeks to 40 weeks is ideal. Okay, but sometimes girl children, they tend to be born early. Girl children, they tend to be born early. Okay, that's what we learned. And again, you saw in the Bible, it says that there's a difference between a boy child and a girl child. A girl child, when a girl child is born, uh, for the girl child to be taken out of the house, for the girl child to be taken out of the house, it takes 40, I mean, it takes 8 days 80 days. That's what we learned. Okay. But for the boy child to be taken out of the house, it takes 40 days. Hi, that's what we learned. Huh? Okay, if you remember those quotes. Okay. So meaning a woman will be unclean when she gives birth to a boy child for how many days? She'll be unclean for 40 days. She will not touch the brazier. She should not cook during that time for 40 days. But if she does, if she has a girl child, she should not cook for 80 days. Basically, today, yes, Africans, yes, they have these teachings, but they didn't really know how long of a girl child they should take. They practice 3 months or what? Okay, so meaning them, the Africans, that's the reason Sebi was rebuking the whites saying, we Africans, the way we are living like the Garden of Eden. All the principles in the Bible, we had them. We are practicing them. But the whites are the ones who pretended as if they are the ones who brought the Bible and started teaching things which they are not in the Bible and pretending as if they are teaching things in the Bible. That is not so. Because the Bible teachings is that it teaches you saying that when you are like or what you call menstruating, a woman she's having her menses, you should not meet. The whites are the ones who brought saying, when a woman is having her menses, you cannot do what? You can meet. But our traditions are against that. You cannot meet a woman during her menses. Uzadwala chifua cha menses chisira. Okay, you have a big cough. Then the wife says, no, you can do. Then the same wives are the ones now says, okay, it doesn't matter. When a woman, she has given birth, it can take less weeks. Okay, they say 3 weeks, you can have sexual intercourse. But according to the tradition, she should be separated for men for 3 weeks. For 3 months. Okay, that is 6 to 8 weeks. So you see now, who has the biblical principles? Is it Africans always had the biblical principles? Okay, unlike what we call high tech or white mind. So these are the things that we learned. So we learned saying the duration of pregnancy should be 40 weeks. Okay, that is 9 months. Okay, so others they would do 8 months, like a girl child, 10 months, boy child, others 12 months. Okay. So these are things that we learned during that time. And the other point that we emphasized during that time also, learned it is against ethics or moral principles for a male child, a male patient, a male physician to deliver babies, to help deliver babies, to be a midwife. It is against the moral sensibilities for a male child, a male physician to help your wife deliver a what? To deliver a what? A child. Or basically to see the nakedness of your wife. Or any woman. As long as they are not going out to that woman, it's against the morals, it's against ethics. Council told us saying that because of that, there are a lot of sins that have mushroomed or come about because of that. People seeing men seeing the nakedness of women, and because of that, a lot of sins have come because of that. So this has been the agitation, saying that let me read this quote. This was the emphasis. This was coming from 13 manuscript releases 114, 114 paragraph 2. It says, but I have felt recently now that you're about to make some moves here, that it is time that I should bring these things out, that it should be so arranged that the women who have greater responsibilities, it is their privilege to be educated just as thoroughly as the men are educated. In some lines of work, in Bible times, the women always took charge of the women. So you say, even in the Bible times, women took charge of the women, men took charge of the men. And the Lord worked with them. I want to say there are many temptations presented to me by individuals that I have kept my own counsel. I have not said anything, but it has been sins brought in by this commonness and the temptations that come in. Now I know of some that have been tempted over matters. I know the women for myself. I know the women are clear, and they are not to be censured, only in one point, and that it is to take their stand of propriety and not to mix and mingle right together. The men and the women taking charge. Okay, so this is clear. According to council, says that women, they should take responsibilities. They should be trained as the men are trained, so that they take responsibilities of women. And if this it continues, what continues? The men taking charge of women, sins are going to increase and temptations are going to increase. So a lot of immoralities or unchastity is going to happen. That's what this is saying. So this was the emphasis during that time. And today we know it has become like a norm today, where we can take our women to the hospital, then the men are the ones who are going to deliver the children, or again, it has become a norm today that men will become, yes, it's okay for men to become radiographers, but and microbiologists, but the radiographers, when women they go for screening, vaginal screening, the men are the ones that do that. Most of them. Also radiographer, it's the same. So according to council, Ellen White has told us, actually God has told us, saying this should be avoided. Okay, this should be avoided. Even without reading Ellen White, you can learn from the statutory laws. Statutory laws saying you should not see the nakedness of who? Of a woman. Right. We are told saying thou shalt not see the nakedness of your woman, your mother, your father, the nakedness of who? There are those laws. Your cousin. Okay. There are laws which God had outlined for the children of Israel to follow. So these are the things that we learned that time. So where we ended, we ended on this one, on the dilation dilation. Okay, this is effacement and dilation. That's why we ended. We learned saying that the child can turn at 38 weeks, 35 to 38 weeks. The child will turn. The child has to turn naturally. The child has to turn naturally. Okay, that is facing the head should face the cervix. Then after the plug breaks, then the water breaks, then there will be dilation. Then the dilation, we see the cervix is not effaced or dilated. Okay, then there will be a time when now the cervix will be effaced and dilated. Then the centimeters, the full centimeters should be 10 centimeters. But at the hospital, what happens that once you take here, the water will break, then the centimeters now they begin to. So they at the hospital, what they do is that I don't know who taught them. They insert their hand to check the centimeters. But it's not necessary to check centimeters. There's that one case which they palpated on the head of the what? The child. Yes, the unborn child on the head. Then they made deformity. They didn't know what they were palpating. Okay, and we know that the child when he's being born, they have what you call the fontanelle, the weak points. The reason why the fontanelle is there, which they call chapamoto, is because God created it in that way that no rupture, the head can be bent, can pass properly on the on the vagina, because the vagina is not very, it can only dilate to 10 centimeters. So that fontanelle is there so that even though the head is squeezed, there's space that could allow that head to pass through the passage of the cervix and the vagina. That's the reason God had to put the fontanelle. So you see how wonderful God is. I don't know, are you following me? Those people who are let me check. Okay. So as the baby's head drops down into the pelvis, it pushes against the cervix. This causes the cervix to relax and thin out or efface. Okay. Then effacement is described as in percentage. For example, if your cervix is not effaced at all, it is 0% effaced. If the cervix has completely thinned, it is 100% effaced. Okay. Or removed or deleted. That is the meaning of effacement, efface. Then the dilation I've discussed already on the dilation, okay, that the dilation should be, complete dilation is 10 centimeters. That is the one. At the hospital says, okay, if you are not 10 centimeters dilated, they'll wait for that dilation. Okay. But it's not necessary to insert fingers. Amaveka mwana kuti ambochoka. Amaveka mwana kuti ambochoka. No need. For this setting of the child, you introduce what you call infection into the vagina. Inserting fingers. And you can cause deformities on the head of the unborn child. So there's now crowning. You see, when it has dilated, then there's what you call crowning. Crowning looks like this. Do I have here? Okay, this is crowning. Okay, crowning. So here you're going to see the child. Yeah, what is crowning? This is when you can see the top of your baby's head through the opening of your vagina. This is crowning. So you know that the child is coming out. This moment happens during the second stage of labor. So meaning there's the first stage of labor. The first stage of labor we learned, saying what? In the first stage of labor, you are going to see the water breaking, the blood. So the water has broken, the blood. Then now in the second stage of labor, you are seeing the child is now coming out. There's dilation, then the child is coming out. Then you see the crowning. That is in the second stage of labor. So we are advised, if you become professional, you discover that you are going to wait for when the water breaks. The water breaks, then you are going to wait for 24 hours. After the water has broken, then that's when you can take your woman to the hospital. Actually, women, they know themselves. If they've given birth before, they know the time when they should go to the hospital. They know. Those who are amateurs, they will go to the hospital early, and because of them going to the hospital early, the hospital, they don't understand. If you delay, they're going to propose C-section. That's what they do. Okay, C-section. That is the proposal. So you should know, because you have just to know. You don't have to go in the first stage of labor. You don't have to go. As you are going towards the second stage of labor, the water has broken. Then now you can go. You wait, because signs of labor is continuous. The pain has to be continuous, not in it is giving you break. No, it has to be continuous. Then the water has broken. Then you have now to wait 24 hours from the point of the water breaking. And now you can go to the hospital. Then from there, after the water has broken, then the water is done. The child has to be coming out. Okay, it has to be coming out. So it takes short period. So meaning that you can spend less time at the hospital. You can spend maybe 30 minutes at the hospital if you know this. Or if you can do it from home, because the purpose of this is to teach you what you call midwifery, to know that you can help to deliver your child. You can help your wife to deliver. Okay, because there'll be time when we will need to have also us, the midwives, to train midwives in our sanitarium or in our camp, so that when we'll be taking these, also they should have this knowledge. Okay, and in case we do not have, we should ask our husband, us as husbands, we should do what? We should take charge. Just like the way this man, Joseph took charge. Remember that in the time of trouble, at the time of the birth of Jesus Christ, it was the time of trouble. You know that Jesus Christ was to be killed at the time when he was being born. Okay, then the one who took charge was the man. Joseph helped Mary to deliver Jesus Christ. Joseph is the one that did that. There was no midwife who came to the aid. Okay, so there are times when we should train, just like during the time of Moses. Remember Moses, the Egyptians, they had midwives, and what Pharaoh did, Pharaoh commanded the midwives, saying, can you kill all the male children of Egypt who have been born? All the male children of Israel who have been born, can you kill them? So what happened is that since the midwives, they understand, especially if you have women midwives, they understand the pain of delivering a child, giving birth. They understand. So even despite the charge of Pharaoh saying you should kill, did they kill? No, they didn't do that. They did not kill the male children of Israel. They preserved them. Okay. And Moses was among them. Moses was to be killed. And God blessed the midwives. And the council stood us saying there was no male midwife during that time. There were female midwives. Okay. So even us, as the present truth believers, we should have midwives in the camp, so that we should avoid taking our children to the hospital, or what you call, to the conventional medicine hospitals, so that they will be delivering your children. Because in those hospitals, what you call, the place is not suitable. If you've listened to them, the place where these are being delivered from, I mean, where the women go to deliver a child, the maternity ward or labor ward, it's not habitable. The environment is not habitable, one, and there's too much blood, the smelly of blood in that environment. If it's in the hospital, you discover that at the same bed, wherever gone up over one bed, they can sleep three, okay? 3 per bed or more on one bed. Unless you're at a private, you're paying more money. But if you see the government, you have to sleep, you have to be there 2 or more on one bed. And what do you call, the manpower is less. Manpower is less. That's the reason those nurses, because they're supposed to have midwives, but they have nurses because there's less manpower. And those less manpower, it's covered that they tend to have their anger. Their anger is high every time. They're upset every time because they have to look at this one, they have to look at that other one, they have to look at this one. And even the positioning of birth, it's like this desk, instead the normal position of giving a childbirth is supposed to be on the squatting position, like the way you do when you're pooping. That is a normal position of birth. But the position of birth in the hospital is not to, what you call, they are raising their legs, and gravity doesn't play a role in giving birth, meaning that if there's no dilation and you don't know how to push the dilation, the child will not come out. Then you undergo what you call episiotomy, or they are going to cut the perineum, they're going to extend the vagina. That's what they do. Okay, so basically, if that happened, now the disadvantage of taking them to such facilities, those people that do not know. Most of people are neglected, and there are a lot of reports. You discover that again, where they're put like on this table, and the facing of the vagina is like on the edge of this table. Then at the end, the child can fall. So if there's less manpower and a lot of labor dilation happens, all of them, imagine that 10 dilations, 10 crowning actors happened in this yard, all of them, they're active, they're about to deliver. Then I'm only one person or two. How can I help deliver 10 at a go? It's not possible. Manpower. Okay. So it's high time, or even just if we were to open a labor ward, we train midwives. You see how many would be flocking, just scattering this city. This compound. If they see that you are treating, you know how to give birth, and you're treating them well, and there's less C-section, episiotomy, and you know how to, you can manage, because pregnancy per day, people, how people flock to deliver per day. There are a lot of people per day, okay, in Zambia. So you can cater a lot of people and cater many lives. Okay. So you've seen how this can happen. But we have less. A lot of people that they have increased. You see, the people that just administer herbs are basically, these are the people that have increased. Administer herbs. We have less, what do you call, treatment. We don't have knowledge in midwives. People to do just simple drips, home treatments is very less. Today, people, they are trained, most of them, they are trained to dispense. Like, you have help, I dispense. I give you, I forget. That's what we've been trained. Okay, so if your infant is too big, your midwife may widen your vagina, that is opening, with a small cut called episiotomy. That is the one I've talked about. Okay, episiotomy. Yeah. Last time I talked of foods that may cause the child to grow very big. You see, avocados may cause your child to grow very big. And once the child grows very big, it will be difficult for the child to come out. So you'll be compelled to do episiotomy. That's the reason, if you remember, saying Ellen White, she said that the highest aim in medical missionary is to be, is what? No. The one that says the highest, we have to learn surgery to become a surgeon. You remember those quotes? Huh? Yes. Because if you do not have knowledge of becoming a surgeon, and you're having cases like, for instance, the child has become very big. How can you imagine you're the one now, you're supposed to, the child has to come out. Then the child happens to be 4.5 kg. It will be too late. It will be too late if you do not know basics of a surgeon. It will be too late for you to, because the child if the child, if the process of the child coming out, it means oxygen will reduce, okay? Reduce, which was connected to the placenta, to the child, okay? And if that happens for a long time, it can cause shock to the baby and also the mother. The mother can have fits. Akakunyuka mwana na yebe akunyuka ambodwala kunyu eba manye bonse bambodwala makunyu. Okay, there are those things that happen. So you have to, or again, you risk the child will not come out. If the child stays for a long time there, also the mother is at risk. Those are the things that happen. So we have to learn also surgery. During the time of Ellen White were fortunate. They had a man called Keagan who was a surgeon. So many, they were very fortunate. So even their sanitarium was very well balanced. So if we are to have a sanitarium, we have to have a surgeon, or we learn surgery as well, so that everything will be balanced. And a lot of people will respect. Just like the way, what do you call? Is it Coptic? Coptic. You see how Coptic it has influenced. It has influenced. It has actually surpassed even UTH. UTH, most of the people UTH again they refer other nations to a Coptic. You see in how that is a church. The only difference that those guys they do not know principles of the Bible. They don't know. They're just following the same patterns of the world. The same patterns of the world. But imagine now, in there you have surgeons, nurses, physicians, okay, well balanced. Then the influence. What influence will you now attract? Even just small, I can mention moms. There are a lot of private hospitals here. There's also moms. Moms is a private hospital. Look at the influence they have. So basically, we can have influence and save many lives. Many lives. That is what you have to understand as well. Okay, it says what is crowning feels like? You may feel a lot of pressure on your rectum, like you need to poop. That is crowning. Females, that's the reason I said there's no need to enter your hands into someone's vagina to check the dilation. The woman will feel like she wants to poop during that time. Okay, that is crowning. So then, if she feels like poop, then you try to enter into, you're going to injure the head of the babe, of the child. Okay. Your baby's exit, where is it? Your baby's exit may stretch you, and you may feel a lot of pressure on your rectum, like you need to poop. Okay. May stretch and irritate your vagina nerves and the tissue between your vagina and anus perineum. They may bend, tingle, and sting as your new bone makes their way out. Some women call this feeling a ring of fire of death. A ring of fire of death. That is the painful part. That is the most painful part. Okay, others they do epidural. Epidural, though most of the epidural or the injection that they do on the spine, they will help you not to control the dilation, because you have to push the dilation. So most of them who do what do you call they have painkiller so that they reduce the pain that they should undergo. They do epidural. They will not have control of dilation. They will not control dilation. I mean, they will not control pushing. Okay. They will not be pushing. They will be failing to push. In short, the dilation. The reason why, because epidural, it numbs feelings in your lower body through a tube in your lower back. It numbs. So because of that numbing, you will not know whether you're pushing or not. Okay, so the episiotomy, there's the vertical and the what do you call the midline and they call it what? The midline and mediolateral incision. Mediolateral incision. Others also they do. There's another mediolateral incision or the horizontal incision. So this one, it looks like this. you're able to see this one. This is called crowning. Then if the baby is too big, the child is too big, meaning they have to extend. They have to extend. They have to cut. They can cut. You see, you've seen the one for going down. The one for connecting the perineum. Pakari pakati aka. You see in this one. I don't know if you're able to see it. Akakari pakati aka. The perineum. See, this is the vagina. Akakari pakati aka. Perineum. Perineum is the area between the vagina and the anus. That area pakati. So bazajo bangajue from here up to here. Or they connect with the anus. So that way increase the passage of the child. Or they can do side to side. Mediolateral incision. But Mr. Chancellor, they don't connect. This will be very deep compared to this one. The stitches are very deep when you cut the side. Okay, they increase the passage. And most of them, others again, if they don't do this, it's still more. If they don't do this, when you do labor, there's a lot of tearing inside. A lot of tearing. So meaning there will be a lot of stitches that are going to happen if the child is too big. Okay. That's what basically happens. So others they do. This is a very quick response. The one they do this one. They can cut you without any anesthesia, any analgesic, no painkillers. Because even the crowning act, it is too painful. And the cutting, look at how women undergo. Without any painkiller. An episiotomy is a cut incision through the area between your vagina opening and your anus. This area is called the perineum. This procedure is done to make your vagina opening larger for childbirth. This is done 2 to 3 of women in the hospital. Actually, most of the women they undergo this today. This is not necessary. You have to understand. So we can avoid this. We can avoid this. That's the reason there are medicines that a person should be taking when they are what? They are towards labor and they are about to deliver, and there are foods that people should be avoiding or taking in moderation when they are pregnant. Then it will make this unnecessary. Okay, so their position, this is what you call cephalic birth position, ideally for labor. The baby is positioned head down. This is head down. They can, that it doesn't matter as long as the child has turned. A child can turn huku, attending it out. It doesn't matter as long as the child has turned. But if the child hasn't turned, it is called breech. The child should turn. And the child should turn maybe at 36 weeks of pregnancy. The child should turn. If the child hasn't turned, it means that mamuna samvera. That is our tradition. That is our culture. You cannot remove our culture from us. Sana teninge mwana. Mimba igarupa mwamba. All the people who will be seeing, they will actually still say, at this pregnancy, mimba igarupa mwamba. Mwana karibu tening. And we learned saying that what will help in the delivering of the child is what?
oxytocin, the hormone oxytocin, the loving hormone. The oxytocin hormone that when you hug someone, when people feel loved, it's the one that is released. It should be released during pregnancy. It should be released during delivery. And when a woman, she senses that you are cheating her, there are no happy hormones being released. The babe will also know. The child will not stay. Zero. The child will not stay.
Is it that they kill themselves that, okay, I have no one to love me?
Because with those ones, they have accepted. Like, prostitutes. Prostitutes, there's a time when they just want to have a child. And they're not there to, because they've accepted their life. They will not dare to tell you saying you impregnated me, but they will say, okay, since you've paid them. So even their mood, your mood, and there are a lot of persons, they have children, but they've never told the owner of those children. Lambid. Because their mood is okay, ever okay, and they've accepted. But imagine that you are married, committed to someone, then someone does not give you attention. Your mood will be done what? Will be affected, yes, will be disturbed. Yeah. The normal weight of the baby is from, we learned that is 2 kg to 3.5. That is ideal. 3.5 kgs. So there are other children that will be underweight, will be less than 2 kg. Okay, so 2 kg to you've given birth before. If you've given birth before, yes, 3.5 is ideal. But so meaning that if a person has not given birth before, the child should be small. 2 kg is not bad. The child will come out easily. Okay. 2.5, 3 kg. 3 kg now they will tend to struggle. Okay. So those are the ideal weight of the children. Yes, Mister. You had your hand.
I was basically on the same line of thought.
Okay.
Sure.
Yeah.
I was on the same line of thought in question period when you said the baby will not turn if the husband is cheating and everything. So I don't know, you state it like fact, but wouldn't it like there's some condition where maybe it's just condition that has caused the baby not to turn. So the mother conclude in those lines because can be conditional, and then someone would conclude say it's because of the husband being, or it's because of emotional attachment or a distortion in how the two connect, affecting the baby. So I was also in the same line to ask to say, oh, are we stating it as fact or is it just my opinion?
Okay. According to culture tells you saying if the child does not, if the member yonika mwambasi, but it's due, it means a man is cheating. That is culture. But according to science, it tells you saying that there are low levels of oxytocin levels. That is science. Oxytocin levels. Oxytocin levels are hormones that make you happy. They are released when you are happy. What you call happy is a Scandinavian word, which uh, happens. It happens when you are happy. It depends on what happens. That is happy. It's different from joy. You understand? So, for instance, a woman. So, Brother Nelson, there are a lot of factors, but most of the factors they connect culturally. Our culture, we connect it to a man. Okay, but the feeling of the woman it is the one, because it's the influence. It's the one that will cause her to release that hormone. So if she feels that she's not appreciated by you,
You want to say something?
Oh,
so
sorry. The young lady was.
Oh, okay.
if she feels that she's not appreciated by you, it can affect her as well. Okay, but most of our myths, they are actually, African myths, almost all of them, they are correct. You know that.
When you say a myth, what I've come to understand is this, that the truth about what you have said is this, that when a woman or a man turns away from the wife and doesn't care, that is what normally the old people in the villages would notice when the child doesn't turn to say. The women were taught and trained to say, whatever happens in the home, if you just keep it to yourselves. So they were not finding time like to tell relatives that my husband maybe doesn't sleep at home, so they will be in that mood of never like secreting or that. That's why for me, I concur with that one to say that was the main problem, such that many times when they confronted the men and said that it is showing that you did not love your wife, that is the result. So unfortunately, in their conclusion, they will think that the effect were coming from your side chick, which is not true. Actually, the effects, as we are learning, were just coming from the body of the woman itself in not secreting enough what, because she felt she was not loved. That's what I understand. So you find that many a time the men would confess that maybe they never loved their wives anymore. Those were in the majority, yes. But others, you find that they would refuse, say, that has never happened. You find that there are certain women also, when they are pregnant, they tend to like hate almost everything. You've seen like even men are made to run around to look for even foods that are difficult even to find. You find that the cravings come for things that you don't even understand. So you find that enemy is understanding, or your refusal to say, that I can't go and find. To her, where the body responds to that kind of anger or resentment. I think those are some of the factors. Like you have said, that there are many factors. So we understand, say, those are possibly the things that we are overlooking. And so many of us were just told to say, when a woman is pregnant, be strong to look for what she will be asking. And some women, sorry to say this, just take advantage of a man, say, if there's a time that I can demand and you won't refuse, is when I'm pregnant. Even the things that they don't want, even that they will say, I want this. Immediately you are just bringing, you say, chachokana kumkosi, chomwachedwa. Now I want this. So you become now more like a slave running up and down. You act opposite to what they require, desires, then she says, he doesn't love me anymore. So you find that other issues creep in. So I think Somehow, it wasn't a myth per se, but that they were just trying to connect dots based on some information they would be able to dig out from the husband and the wife themselves. Thank you.
Okay. So you've seen that in our culture it's called myth, but it is science because they were observing. They had observed saying that because of this, and science confirmed that because of this, the child was not turning or mimba sienzeri kugwa. That is child turning. Mimba isimafunika ti ya ili 38 weeks wenda na kupapa mimba ikaliso si kugwa. Ifunika mwana attending, the child has to turn, then mimba yagwa so. Okay. So if any person who is older would tell, because you know that our women, they kudala before the ma hospitals before ma midwives zeri batu bazimai batu makolo batu benzo ziba mupapisira bana baziba na kuziba no kaili banaenda mambiri banaenda apatentina
be cheated by town life. These are people that are helping in the great majority of Zambia is helped by these so-called untrained midwives in the villages. And all they do is, when these ladies are almost due, I've traveled many places and I've seen this. The woman who is about to have a baby, they just buy a new wrapper, and they keep it in the house. And when they are due, they will just call, they will tell the elders that I think I'm due. They organize those old women. They come and help deliver. Then that lady will just give them that chitenge or wrapper material. And these are the people that are helping in the rural areas, because very few places, I can assure you, have even health centers. And those health centers that are in the most typical rurals have no facilities for childbirth. So most of them, it is done in homes. So they are still there, except when they introduce a clinic, they bring in these myths of saying, no, those are not doing it right. But when you look at the generation of people that have grown in the villages, most of them were born like that. And also, like we were learning the week before last, to say a man should not be a midwife. We've never seen any man, brother man, in the rural areas, except maybe your own wife, like you're saying that suddenly things happen in the night and you can't do anything, that you help your wife to do what? To deliver. But quickly they also rush to those same houses of the women to go and knock, so that they come and help, like make the baby warm and do the needful, like cutting the rest and everything else. That is what happens up to this point in the rural areas. I'm telling you, that is what happens. But you never see a man going to a friend's house to help the woman deliver. Whatever pain is there, no one would go to the fellow man and say, oh, my wife, come and help me. There's nothing that has happened like that. They always rush to women, which is showing you that indeed, even our African society believes that the helping of giving birth, the work of midwifery, is specifically for who? For women. Last week at church, we are looking at Aaron and the birth of Moses and the midwife. I brought that out at the church. I said, you see that here, Pharaoh had the military. And when he saw that the midwifery was not following his orders, that all the male children of Israel should be killed, he never ordered the midwife say, you come out of here, we send men to help. Why didn't you do that? He knew that that is not the role of who? Of men. But today society is turning upside down, and we are happy to have men being trained as what? Midwifery. And instead of maybe being restricted to their own families, now they have even been employed by government and they are delivering innocent women. Of which inspiration is saying that it is not right. And most of the women were even saying, yes, where did we get this idea of training men? Then one elder said, maybe it is because of the difficulties But inspiration says that we train women to do it. You see, if you know as a man, your duty is to train women so that they do it better. So basically, brothers, let us not be cheated. Most of the people you see from the villages, most of them were born through the help of the so-called untrained, I want to use the word untrained midwifery from the rural areas. Most of those, it's only a few of us that are in these cities. And when you count the cities, my brother, they are very few as compared to the far-flung areas of Zambia. If you remember, like the other time, even President Manawasa was shocked to find that there are a lot of people in Shangombo, isn't it, Pramnaro? There was no health post, no road, no nothing, but the population was big. You remember that time, huh? Shangombo and there are two places that side that were discovered in Western Province. You see, but people are there. Who is helping them? Why are there no serious deaths reported? So this myth, what I've come to understand is, it's like in business. If you want people to come to the clinic, you discourage what they are using, so that they see that what they are using is evil. So that they say, oh, now the best way is this one. You see? And now they are even bringing to say, oh, if your child is not born in the clinic, he will not be recorded. Who records those in the rural areas? Because you see, it's just a matter of trying to push people to rush to the hospital, so that all of us, we have the mindset to say, oh, unless you go there, that's where you find healing. You look at even in medication, they are trying to suppress the herbal remedies by saying that they are not tested, they are not proven, and they are not approved. So now when you look at it, those three statements, they are pushing people who understand other ways of helping to say they are illiterate or ignorant until what they have is tested or proven. But the question is, who proves and how do they prove? You see? So those are just the semantics that are used to just discourage and then promote what they feel is on a better side. Thank you.
So you've seen, huh?
Yeah. Brother Keagan.
Yes, Angoma.
Oh, sorry. Thank you so much. And the other part is like we have heard from Brother P also. You also find out that you will never find a lady being called a chairman, or a woman being called a chief, but a chieftainess. So there's something always to refer to them that they are women and they are men. So a lady who is chairing a meeting will be called a chair lady, not a chairman. Okay. Now, why is a man called a midwife? Okay. So they could have been a term referring to, so this is separate from women. So a midwife, the term wife comes from feminine personnel. So why referring to a man as a midwife? Instead, maybe they could have called him a mid husband or so. So this shows that this is just complicated in itself. Otherwise, we appreciate for the insight, also finding out that if we can understand these processes, how they can be done, then the solution can be solved. So the fact that we are not yet very much acquainted, then we are still going to the hospitals. But if we can have some among us who will be vested in those, especially the females, the women among us who will be vested in that information, then we will be helped somehow, somewhere. Thank you.
Okay. So my right? Yes,
Yes, and I've just seen it, so I read it. Okay. So, just in line with, before I come to the question of that Brother Bernard forwarded to my phone, I want to read this. It says, a male midwife is simply called midwife. That is Google. While the term midwife historically implied to a female practitioner, it is now a gender-neutral term for anyone, regardless of gender. Are you seeing the confusion? So they are trying to steal something into what it is not. You see? So historically, they are saying it was relating to who? A female helper. Yes. So that is what Google has brought. Thank you. I thought maybe, as Brian Ngoma was saying, maybe there is some special name that now they have adopted. I'm sure with time, with such questions and the things that we are talking about, maybe they will think of other things. Okay. Yeah. So this is when the question from Brother Bernard just came in. It says, okay, care duties of a midwife. Huh? Then it says, midwives specialize in supporting women through pregnancy, childbirth, and postpartum. Their responsibilities often include, number one, antenatal care, that is before birth, monitoring maternal health through exams, vital signs, and lab tests. The next point, educating expecting mothers on nutrition, exercise, and birth options. The next point, screening for complications like gestational diabetes or pre-eclampsia. Pre-eclampsia, yes. Hypertension, okay. Okay, thank you. Then the next point is preparing birth plans tailored to the mother's preferences and medical needs. Okay. Then intrapartum care, that is during labor or delivery. That is assisting with labor by guiding breathing, movement, and pain management. The next point is delivering babies safely, either at hospitals, clinics, or homes. So you see that they should know that even at home, somebody can be able to what? Deliver. But today they are forcing everything on. Then it says monitoring fetal well-being using equipment and observation, managing emergencies with swift referral or intervention when needed. Then postpartum care, that is after birth, checking recovery of the mother physically and emotionally. Next point, supporting breastfeeding and newborn care education. The next point, providing family planning and contraception advice. The next point, identifying postpartum depression and referring for support. Then the next point is community and preventive work. Midwives also have roles beyond clinical settings. The first one is health outreach in rural areas or underserved population, cultural sensitivity in child practices and tradition. The next point is educating on sexual and reproductive health in schools or community centers, just like Brother Keagan was given. Now, the question is, are the other duties of male midwives also forbidden? That's Brother Bernard's question. Yeah, so he's saying when you like want to deliver, a male is forbidden from seeing the nakedness of the other woman. But now looking at these other services, like you say, postnatal, prenatal, where you help to check the growth of the baby, is that also forbidden, or it is just that time when they are supposed to deliver? I think that's the question.
Okay, but in that quote that we read, it says there's a time when it is necessary for men and women to mingle. You read that part? Do you remember that part in the quote? Do you have there the quote where it says there's a time when them men and the where is that quote? Let me just go there. That is 13 manuscript releases. Huh?
Yeah, 13 manuscript releases
144.
140. Yeah.
Okay. Yes, the same one. I think it's on top. Maybe see the one I'm talking about. Let me just return now. The time has come now when they are to be under. Okay, so the time has come. This is 13 manuscript releases, page 113, paragraph 2. It says, the time has come. The time has come now when there are to be and there should have been long ago sensible changes. Men have their appointment to take care of the men, and women are to take care of the women. But when it comes to bringing the men and women together in private practices of childbirth, such such cases to have them associated right together, I should say it is not right nor to be justified. Women had their appointed work in the Bible times, and these women took charge of the women, and there was a special understanding that that was the way it should be, and that is the way it should be now in childbirth. Let the women be as thoroughly trained as the men, and let them take charge of these matters. I speak intelligently. I speak because I understand what I am speaking about, that there is too great a commonness. This is not the one, huh? For the sake of time, let me answer it. The only thing that the men should not tackle the issue of women is to do with privacy. I gave the example of, for instance, radiographers, you know what they do. Huh? The radiographers, they do radiographer activities, like they use ultrasound or x-ray. Okay, and sometimes ultrasound scan will require a woman to undress. And microbiologists again, they do swabs, vaginal swabs. So those things which are dealing with the private parts. A woman should not, for instance, do circumcision, male circumcision. She should not do that. A woman, there are cases like she should not put catheter, a woman. For instance, there are patients where a patient is very sick, cannot move, but is a male patient, then a nurse should be the one who do wazamwika kachani kaja ka urine bag catheter mungenesa kuchani in the urethra, the penis. So you've seen such. So the issues to do with nakedness of the other gender, women should not do and male should not do. That is the principle that is outlined. Yes, unless your husband and wife. That is the principle. So there are a lot of them. A person is poo-pooed, okay, who is going to what? To undress? Because even our culture, remember our culture, no matter how severe the sickness is, you cannot, a girl child cannot come to begin to be undressing wa batete back or wapongozi. That doesn't, it's an culture. But look at now in the hospital, they do. Tumanese tungabwere muntu twabwera twachinja chinja. They do that. You give them diapers. A patient is very sick, has stroke, cannot move, is paralyzed. They will do. They are the ones who will be doing that. Or is very sick, or an avironda, bed sores. They do. They are the ones that do that. So those are the things. And in male circumcision, actually the females, they are paid more money. Those that do if they are the ones who are on duty doing male circumcision, they are actually promoted to to do male circumcision, females, and most of them, they're the ones that do that. Female nations doing male circumcision. So the rule that is outlined in counsel and the Bible is that we should follow the law of nakedness. Remember that law of nakedness in Leviticus? Do I have it? Aja. Don't know if I have. Let me check. That time I said I should check it. It's in Leviticus what? The one? Law of nakedness, Brother Penat. Okay, it says, yeah, Leviticus 18, of course. It says, Leviticus 18 says, ye shall therefore keep my statutes and my judgments, which if a man, that is Leviticus 18, 5 to 20 and 22 to 24. It says, ye shall therefore keep my statutes and my judgments, which if a man do, he shall live in them. I am the Lord. So these are statutory laws. That's what, according to this verse. Then it says, none of you shall approach to any that is near of kin to him, to uncover their nakedness. I am the Lord. So your relative, you shall not approach to uncover their nakedness. You should not do that. Verse 7 says, the nakedness of thy father or the nakedness of thy mother shalt thou not uncover. She is thy mother. Thou shalt not uncover her nakedness. Verse 8, the nakedness of thy father, thy father's wife, shalt thou not uncover. It is thy father's nakedness. Okay, just like who was this? The firstborn of Jacob slept with who? The concubine, huh? Okay, uncover the nakedness of the fathers, okay, of the father. So then verse 9 says, the nakedness of thy sister, the daughter of thy father, or daughter of thy mother, whether she be born at home or born abroad, even their nakedness thou shalt not uncover. Movie says, or your sister, the nakedness of thy son's daughter. What is this? That is the nakedness of thy son's daughter, or of thy daughter's daughter. Are you understanding this? The nakedness of thy son's daughter. Huh? Or of thy daughter's daughter. Even their nakedness thou shalt not uncover, for theirs is thine own nakedness. The nakedness of thy father's wife is daughter. The nakedness of thy father's wife is daughter. Begotten of thy father, she is thy sister. Thou shalt not uncover her nakedness. Thou shalt not uncover the nakedness of thy father's sister. She is thy father's near kinswoman. Verse 13, thou shalt not uncover the nakedness of thy mother's sister, for she is thy mother's near kinswoman. Thou shalt not uncover the nakedness of thy father's brother. Thou shalt not approach to his wife. She is thine aunt. Thou shalt not uncover the nakedness of thy daughter-in-law. She is thy son's wife. Thou shalt not uncover her nakedness. Thou shalt not uncover the nakedness of thy brother's wife. It is thy brother's nakedness. Thou shalt not uncover the nakedness of a woman and her daughter. Neither shalt thou take her son's daughter or her daughter's daughter to uncover her nakedness, for they are her near kinswomen. It is wickedness. Emphasis, thou shalt not uncover the nakedness of a woman and her daughter. Neither shalt thou take her son's daughter or her daughter's daughter to uncover her nakedness, for they are her near kinswomen. It is wickedness. Neither shalt thou take a wife to her sister to vex her, to uncover her nakedness beside the other in her lifetime. Also, thou shalt not approach unto a woman to uncover her nakedness, as long as she is put apart for her uncleanness. Moreover, thou shalt not lie carnally with thy neighbor's wife, to defile thyself with her. Thou shalt not lie with mankind as with the womankind. It is abomination. Neither shalt thou lie with any beast to defile thyself therewith. Neither shall any woman stand before a beast to lie down thereto. It is confusion. Defile not yourselves into any of these things, for in all these things the nations are defiled, which I cast out before you. Okay. So this is very clear. Even God had these statutory laws put outlined in black and white to the children of Israel. Okay, so they had them, they were reading them. So even today, we should have, as Seventh-day Adventist Church, we should have these laws so that we should not defile ourselves as a church, so that we should be pure without guile, without blemish, right? Okay, because it's impossible. For instance, you're from seeing someone's nakedness, then like me, I'm a radiographer, I'm from seeing someone's nakedness, then they are women, then I come to church, I'll be able to, you know how they say that once you see what is behind the curtain, you cannot pretend not to know what is behind the curtain. You've already seen the nakedness. Then I'm a preacher. Then I saw this one's nakedness. Then when I look at her, the images will be popping in my mind. Those are temptations which Ellen White was talking about. Okay.
From the reading of this verse, it appears like it's because even the title of the chapter saying unlawful marriages and lust. Yeah, and this it appears like it's talking to a man, never take advantage of anyone in line to what does bring good forth.
Okay, so she says it appears that a man is taking advantage of someone. Okay. But we read, there's a part which I emphasized. I don't know what verse was that. I emphasized saying you should not see the nakedness. That one wasn't your relative or not, but you should not see the nakedness of the woman and the daughter, right? Who is not your wife. You should not do that. And her daughter. So to lie, that is sexual intercourse. Okay. Are I know, have you gotten a point?
Yes. What they say is simply this, that when you look at what we have read in Leviticus chapter 18, it is more like God was addressing the man to say, you should not take your brothers, all that we have read, except when you are saying that when you come to verse 23, where it says, neither shalt thou lie with any beast to defile thyself therewith, neither shall any woman stand before a beast. So that now you see the difference here. When God is saying thou, it was more like speaking to the man, to the man, to the man, to the man. But when now the woman is involved, that's where now God says, she too cannot take herself and sleep with an animal. So now her point is, this does not discredit the idea that if she is sick and the sister can take good care of her, like to clean her, to wash her, and everything else. That's what she was saying, isn't it? Yes, also like you, a man, you are sick, your brother can take care of you and wash you. But what is discarded now is the relationship in that arrangement. If she is your mother-in-law, she's not supposed to do it, isn't it? According to what we have read, right? Yeah, maybe those are some of the specifications, though the Bible hasn't gone to that extent, but we are just looking at where other things can be able to come in, like helping, like sister to sister, you can be able to wash her, clean her, no problem. But not me, my sister is sick, as a man, I say, since we are just the two of us, I take my sister, start bathing her. I'm sure you remember the uproar that happened at UTH where the father traveled, is it from Southern Province with a daughter?
Yes.
And then he was washing and taking care of the daughter. Then people were seeing that because the daughter, I don't know if she had a sore or something, she used to cry when she was being bathed. So people got concerned in the hospital and said, how is this? What is this man doing with the daughter? And so the outright report that came was that the man was taken to court. I'm sure you heard that he was sleeping with his own daughter, which was called incest. Now, I followed that story. The people that were dealing with it are from Kabwata SDHH. Because Chimbukaira prison, those come to worship at Kabwata. They said actually, the truth was that he never slept with the daughter. And when they checked, there was nothing like anything had ever happened between the two, except the pain that the daughter was going through as the father was bathing her. And the only charge they gave him was he shouldn't have been bathing the daughter. But he said there was no one to help. I don't understand the condition that the child is in as to what led him or what made people to stop like helping in that regard. So that is basically what Sister Olivia was giving to say. Those are some of the extremes that the Bible is saying that there is no way I can take my daughter to bath her or my daughter's daughter, but my daughter's son, as a man, I can be able to clean him. Yeah, but my daughter's daughter, neither her, no, those.
Okay. I know it's clear. It's clear because the principle that we got from Leviticus 18 is that a man should take responsibility. If we marry it with the quote by Ellen White, a man can take responsibility over a man, but a man cannot take responsibility over a woman. That is clear. So if we go now into a discussion, let's cover that there are times when a man cannot see the nakedness of the father. You understand? Just like in the case of Noah. Okay, there are times when also your daughter can't see your nakedness. So there are times when she can see the nakedness if you need cause. If need cause is in the case of when you are sick, okay, in the case when you are sick. But principle, if we follow principles, we have to stick to this. Women should take charge of women, men should take charge of men. Basically that. There'll be less temptations. Yes.
Yeah, true. True that men should take care of men and women should take care of men, but that would be applied to us Christians. Now, we are the only ones who can do that according to the Bible. But since the world is changing now, there's the issue of transgender. The world considers that every person has the right to do or to act according to the way that person feels. If I feel like I'm a woman, then I need to act according to the way I feel, isn't it? So no wonder even the men are becoming midwife now. So my thought has gone. But so when it comes to that, it's up to us now to take the action as a Christian to build up these facilities whereby only women can do that and only men can do that. I think I'll end there because my thought are gone. Sorry for that. Thank you.
I think you've answered. You wanted to ask a question and you've answered the question. Because look at in this time, in this era, where we have lesbians, homosexual people, they don't even know what is a woman. There's a debate what is a woman. But in Zambia, we discover that in Zambia we're still against gay rights, and lesbians, homosexual people. We're against that. Okay, our constitution is still protected in Zambia. We are still protected. But here, this discussion has come because we need, as an association, we need to have our own rights. So if we have our own rights, we have our own camp, meaning that we as Christians, we cannot condone lesbians, homosexual people, gay, because in the Bible, if you read those quotes, it's covered that even in the time of the Bible when it was written, we had people who were sleeping with what? With women sleeping. Right? Okay, we had people sleeping with animals, but God wrote those things so that as the children of Israel as a nation, they should have their constitution or law that should guard or protect them from such practices. Also, likewise, we have a privilege to have our constitution as well as us, as Christians, this movement, to guard or protect us from such immoral practices. Okay, so we can have that. And all those who are Christians, who are in this movement, they will not be participating in such. We have examples. I gave the example of how the Islamic people do it. They have their, if they have their hospitals or clinics, what the woman will handle women, men they'll handle men. Okay, they don't need the state to interfere. So even likewise, our religion, we can involve men to be handling men, women to be handling women in cases of privacy. That is what should be ideally be followed. Okay. I hope.
Maybe just like you are saying, the verse is actually the same. Leviticus chapter 18. I'll start maybe from verse 26 and then go down to verse 28, just to cement what you are saying. It says, "Ye shall therefore keep my statutes and my judgments, and shall not commit any of these abominations, neither any of your own nation, nor any stranger that sojourn among you." Verse 27, "For all these abominations have the men of the land done." We see, like Brother Masuzi was saying, this is what they are doing, at which were before you, and the land is defiled. 28, "That the land spew you not out also when you defile it, as it is spewed out the nations that were before you." So why we are doing all these things is because God commands us to keep them, not that society. We know that society and everything will always be polluted and defiling, and it's that reason that judgment will come upon man. So God is saying that if we want to be spewed like all others, let us follow what they are doing, and then the fate that they will receive is the fate that we also receive. Thank you.
Okay, so we've seen that this homosexuality and stuff, they are not even during that time they were there. See, but God had to put a law, a statutory law that was to protect his people. Also, likewise, today he has put a law that has to protect us from such abominations. So I don't know if there are more contributions or questions, because I'm ending here. This is 12:34. Or the one says, okay, woman better than death. Okay, yeah. Ecclesiastes chapter 7, verse what? 7, verse 26. Okay. Kwasira, kulibe mafunzo. Kulibe mafunzo wamene muli online. Kulibe. Angoma, watembo, Mr. Benson. Okay. Okay, then I end here.
Thank you so very much, Brother Keagan, for that presentation. At this time, we shall humbly kneel down as we ask Brother Melek to close for us in prayer, and also to remember to pray for the food.
Shall we pray? We thank you, our Heavenly Father, for giving us an opportunity to kneel down our needs before you in the holy hours of the Sabbath. Thank you for the morning session. We ask for the Holy Spirit, even as we go for break, to continue with us in the second part, afternoon study, until the end of the Sabbath. Bless the food that's been said, that shall be set before us. Remove the impurities, and that we may give us the strength, also power to listen and understand. We pray and ask in Jesus' name. Thanksgiving in our heart. Amen.
Okay, thank you so much. This marks the end of our morning session. We meet at 14:30 for the Bible study. And this one I want to announce outright. Brother Mnarua has requested that at least we tackle a few questions. For today, we turn it into a question and answer. So, Brother Bernard, you come and then we'll be helping each other. Questions will come and then we'll be answering. Thank you so very much. So that at least as we go for lunch, we know that we'll continue our usual study the other Sabbath, isn't it? Thank you so very much.